Well, good morning, CHD. It's that time again. If you see my face, it's Friday morning and it's time for doctors and scientists. And one of the things that we really saw when we went out on the CHD bus was reports of hospital protocols. And those were really chilling. I mean, we really wasn't something that Polly, Tommy, or I expected to see so much of. And I want to introduce our guest today. She is absolutely amazing, with a background in PR consultant, but she has been instrumental in terms of helping people regarding hospitalizations, hospital visits, advice, legal, helping people know their legal rights, regarding what goes on in a hospital with their care directly or with the care of their loved ones. Let's bring on Laura Bartlett. Laura, you run the Hospital Hostage Hotline, and it's absolutely amazing. If you go to your website, it's protocolkills.com, PROTOCOL kills.com. It's packed with information. I was really nerding out on your website.
I have to say, it's not my website, but it's I had the privilege of somebody, I had the honor, and I am so grateful that they let me park my information there. My extensions are ourpatientrights.com and Hospital Hostage Help, but it's an extension of Protocol Kills, which is Greta Crawford's site.
Oh, great. Thank you so much for clarifying that. Your story is so interesting. I love the story of how you got started during the COVID pandemic. But if you could unpack that for us, that would be great.
Sure. So early 2020, as you know, my brother, Dr. Richard Bartlett, had a protocol that was working early 2020 after hydroxychloroquine was kind of shot down. It wasn't an option. And so people didn't really have anything else to really cling to hope for. And he was starting to do some, he had a lot of COVID patients come in through the ER that needed help. And he started using budesonide, which is a inhaled steroid, to great success. A lot of people recovered within 3 days, and it just wasn't known, or it wasn't widely known. Maybe other doctors were doing it. Other people just hadn't really talked about it in the news. And with my PR background, I said, when I heard that it was having success, even if it was just a handful of people at the beginning, I think as early as like April or May, he was having great success. And he said, boy, I wish more people knew about this. And I'm like, yeah, people do need to know about this. So with my PR background, as soon as he told me about it, within 24 hours, I had him on the news of a local affiliate, I believe, of NBC. And that kind of broke the story. And then within 60 to 90 days, I can't remember how, it was really quick, got him on a podcast through a connection of mine. And that podcast, America, Can You Talk, with Debbie Georgatos in Dallas, it went viral with over 5 million views. And then YouTube, of course, pulled it. But by then, the cat was out of the bag, so to speak, and it was known around the world. Inhaled budesonide, something that asthma patients regularly use, were having amazing success, and it was available, at every hospital pharmacy, FDA approved. And so it kind of went viral around the world.
That's incredible. And, I have to make the connection, your brother's in Lubbock, Texas.
He's not in Lubbock. He's actually based in Midland, Texas. But
okay, that's right. Never
mind.
Was
helpful with the Covenant, the hospital situation with measles recently.
Right. I mean, he was so instrumental. And I was able to, meet him online and went down to the sort of the epicenter of the measles outbreak in Seminole, Texas. And Dr. Ben Edwards was using the budesonide albuterol protocol on these kids who had measles pneumonitis. They were just, they were having trouble breathing, and these kids were recovering. I saw something nigh unto miraculous with a 4-month-old that had measles, who, was really, really sick and really, really struggling for breath. And that, that little boy recovered within 24 hours. So,
Right.
I'm so thankful. I mean, it goes on. It was extended from COVID to measles, pneumonitis, and also secondary bacterial pneumonia associated with measles. And so I'm so thankful for that and for that connection. And then you've taken this really, further
Mhm.
because of what was going on, and I think it's still going on in the hospitals, starting with COVID.
My first hospital rescue was in 2020.
Wow.
I am a reluctant, advocate, patient advocate. That's not my background. I kinda
Mhm.
escaped the family business of medicine. I'm an entrepreneur and I do other things, but Um, this gentleman somehow found his way to me because of my experience trying to get budesonide known, trying to promote
Right.
that. So this man in New Jersey had a father that was in his 70s, and he went in for a urinary tract infection to the ER because his own doctor apparently, allegedly would not help him. And so he went to the ER early 2020, or I should say it was later in 2020, but early in COVID,
Right.
and they admitted him for urinary tract infection, tested him for COVID, and he quickly his health started suffering and declining. He lost a lot of weight. He started getting weaker. He acquired pneumonia. It was bad. And so this gentleman reached out for help. And I said, if it were my dad, I'd get him out. And so
Mm.
we got the wheels in motion, got him out. He escaped in his hospital gown with his Foley catheter still attached, dangling between his legs because the
Oh my
hospital would
goodness.
not. They were upset he was leaving. They said he wouldn't,
Wow.
insurance wouldn't pay. They said everything to keep him in the hospital, but he escaped and he survived. And, I got periodic messages from the son later, in the last couple of years, that,
Mhm.
"My dad's on a 3-mile hike. Thank you so much." Then he told the story on InfoWars. He just kind of interrupted a viewer call-in section that wasn't even about hospital rescues, and he said, if I've got a minute, I'm gonna tell you about this hospital rescue." But anyway, um,
Wow.
anyway, that was my first one, and I have to say that there's still situations going on in hospitals right now because they have gotten so brazen that, informed consent is just not even widely recognized or honored by the hospital
Right.
doctors. And so my goal is to protect them with a strategy that came to me from a hospital insider with, an RN, a JD,
Mhm.
who had administrative experience for over a decade. And, it would come this idea only came through an insider. I did not come up with it. And this person was advocating on their own to help patients during COVID. And, this strategy is using a document and delivery strategy that you would only, know how to get around all the roadblocks of doctors, taking a document that gives you your right to informed consent and throwing it in the
Right.
trash. Well, we've got a way around that, and it requires a patient to be proactive, to complete a document before you even walk into the hospital.
Mhm.
You have to be a patient. They have to have a, active record on you. So if you go to the ER, have this document that is predicated. It's modeled after the Jehovah's Witness ability to decline blood, and
Wow.
it's something that I would never have known about. Most patients don't know about. If you don't work in a hospital, most family practice doctors will not know this. They're well intentioned to say, well, just say, don't give me this or that. But we know now, after advocating for, the last 4 or 5 years, that doctors can say, I didn't hear the patient say no. It's whatever the
Right.
record says. And so for you to have your own documented uh, contract with a doctor, you're going to set the terms and say, this is what I absolutely do not consent to. I don't consent to this drug or this treatment, or a vaccine, a tetanus vaccine or a COVID
Right.
vaccine. It doesn't matter, or a flu vaccine. I don't consent to it if that's not what you don't consent to. You can't just say it. Patients have gone so far as you may have seen this on social media to write no remdesivir on their arm
Right.
with a Sharpie, and that's not a legal document. Okay. They
No.
don't have to honor that because they don't know who wrote it. It's not, you don't sign a lease contract on your arm or a
Right.
business contract, it has to be in paper. And so there's a system that this very brave anonymous hospital insider gave me this strategy, and we've been using it to great success. People who've used it for hip surgery, knee surgery, back surgery, um, gone in to have their baby, they checked their records and they did not get whatever they had in their electronic medical record that they said they
Mhm.
did not want when they delivered this, because the general consent has clauses in it, we found, that say that if a doctor, you're consenting at the get-go, as soon as you sign that general consent, that you consent to any biologic. Well, what's a biologic? Most people don't read the fine print. It could mean
Right.
that you're getting a vaccine or a drug that the doctor deems necessary. You're already giving your prior consent. This document, if you deliver it, is a carve out, and it says, regardless of the general consent, which is your kind of
Right.
business contract, these are things I absolutely don't want. And if you can say it, which you can say, I don't consent, and they should honor that. You're basically just giving the doctors a courtesy of writing it down. And so you're going to write it down, you're going to notarize it. We've got a template at ourpatientrights.com. That's OUR patientrights.com, where patients can download that for free. I don't do anything with any kind of payment. I don't want to hide anything that could save a patient's life behind a paywall.
Wonderful.
I know
Right.
that Remnant Healthcare has also done that. I appreciate them sharing this document. In other places, Dr. Stella Emanuel
Mhm.
just tweeted out just a few days
Wow.
ago that you need to do this. It could save your life. Lots of doctors, I know doctors who've used it for their own family. But this is the way around PrEP, which says that you are not responsible, doctor. You cannot be sued for malpractice or neglect. Well, that's a lot of what happened in the hospital. But there is one caveat. There's one
Yes.
workaround, which is there's a clause in that PrEP Act that keeps them immune to lawsuits, which is willful misconduct. Most people don't talk about this. You mean this is news? This will be news to you, and a
Right.
lot of people. Is that how do you get them for willful? Well, if it's written down and it's in your electronic medical record, and it's been notarized, which proves that it's you that signed it, you gave them advanced knowledge. You don't want these things, and if they do it anyway, that's willful misconduct. That's intentional tort of battery. That's how
Wow.
you prevent anything going forward. I don't care if it's turkey flu or sloth pox, whatever they come out with, that's gonna be the next
Right.
thing that they wanna push a drug on you or a vaccine and say it's part of the protocol. You are bulletproof. This is the silver bullet, really, because it's a simple solution to a complex problem, that if you have this in your electronic medical record and a doctor does it, he's not going to risk his medical license. He's not going to risk a lawsuit that he will not win, because
Right.
we've got the evidence. And the evidence is that you get a courier service to deliver it to the CEO, who's tasked over all the affairs of the hospital. And it took an
Right.
insider to know this, that the CEO will then do what he needs to do to push the document into the electronic medical record, because he doesn't want anything missed, an allergy or a drug allergy, a food
Right.
allergy, whatever could compromise a patient that they
Right.
have notified the hospital of. It'll get into that electronic medical record. And then all the care providers, it doesn't matter if there's 20 different care providers taking care of you, pulmonologist, cardiologist, whatever, uh, they will all see it. And if it's documented in your electronic medical record, then and you've got proof because you have receipt of delivery, because the courier will have a signature and a date
Right.
that the hospital got
Mhm.
it. You can sue that doctor if he gives you a COVID vaccine, a flu vaccine, a tetanus vaccine, whatever. If you did not want it and you stated it in a document, that's your caveat. You probably have never heard that. I didn't know about it, full disclosure, until this hospital insider gave me the strategy.
It needs to happen. It
Yes.
absolutely needs to happen. You know, parents, families, individuals, I mean, they cringe about going to the hospital because
Mhm.
of these horror stories that we heard from these protocols. I mean, and you've participated in rescues to get people out of harm's way. I mean,
Yes.
it is so insidious. Now, how long? Not that I would recommend stop doing this after the PrEP Act, but how long is the PrEP Act in effect?
Till 2029. And so I recommend, don't trust that you got the one unicorn in the hospital that actually has a some morals and ethics. I'm a
Right.
Christian. I wouldn't violate someone's informed consent, but you can't count on that. So why don't you keep
Hmm.
people honest? And good doctors will love this. Good
Right.
doctors will love this because all it is communicating very clearly that these are things I don't want. That way there's no accidents. There's no a good intentioned doctor will
Hmm.
want something that he can just look at and not keep asking you. There's,
Right.
medical error is the third leading cause of death in America.
Absolutely.
Why not just put it in writing so that it's very clear, very, very clearly communicated, and it's in your record? I recommend that if you switch hospitals, say you transfer to a hospital, have copies and do the same, repeat the process over again. It should
Right.
port over to the new hospital, but why take a chance? It's your life, right? And so have your original copy at home. If it needs to be revised, it can be revised.
Right.
If you find that there's a new drug that comes on the market that you don't want, do the contract over again at ourpatientrights.com, or it's a template. You can change it, you can revise it. I'd also, for my own, this is what Laura Bartlett would do. There's a blank spot on there that I would write in. I consent and request person's name, date of birth,
Right.
gain immediate access to my electronic medical record, because when you're a patient, you don't have the wherewithal. You're sick. You don't have
Right.
time or energy to go look and double check a hospital record to see if the doctor's being honest. I know a patient that was given fentanyl every 30 minutes that I was advocating for. The unfortunately, the patient's wife never got access to the electronic medical record like I recommended, because they have crisis brain. It's really hard to get
Right.
people to react and do things when they're upset and stressed. The time to have a plan is before a house fire. Know where your exits are, know where your fire extinguisher is at. It's not the time to learn on the job. So I recommend people go to ourpatientrights.com and get familiar with this contract system. You want to keep your doctor honest. Get into
Right.
your electronic medical record, your family member, whoever that is, you're going to waive your HIPAA rights to, so that there's no roadblocks, because they make it very difficult for people to get into their electronic medical record as a patient. You don't want to find out after your loved one is dead
Right.
that they got fentanyl, that they got a vaccine, there's so many people that I'm hearing that have gotten things they never asked for, they didn't want. The gentleman who got the fentanyl every 30 minutes had double knee surgery before he ever went in for COVID, and he never took a painkiller more than a Tylenol from the grocery store. He even for the double knee surgery. So he did not ask for that. I doubt
Hmm.
that it was even really warranted. That's my opinion. And the opinion of the family. And so
Right.
what you want to do is you want to keep your doctor honest by going into that electronic medical record, make sure that your contract's visible there, your current caregivers and consent document that I mentioned earlier is in there with your wishes, your I do not consent wishes. You can also have some consent wishes that you request, like budesonide in the case of COVID.
Right.
That was an option, and you want to complete it like a contract. You want to initial next to things. Don't put a check mark or an X. Only initial the things that you want, and add things that you want, and initial those too, and then notarize it so it is a legal contract.
You answered my question because my question was, making sure that the documentation ends up in the electronic medical
That's how
record.
you do it.
And,
Yeah.
it's genius to be able to have your loved one. I mean, your designated patient representative, which you should um, have that access so they know, in real time what is going in your body. And also they know that there's a legal document sitting right there in the EMR saying that no, don't do this, yes, do
That's
this.
right.
The other thing that you answered is sort of near and dear to my heart because of the two girls who passed away in the measles outbreak, and they passed away in hospitals in Lubbock, Texas, one at Covenant Children's Hospital and the other one at University Medical Center. Neither one of them were appropriately treated. And so, I think that being preemptive for something like that really, really could have changed their care.
The document is for people who can consent for themselves. It's for
Right.
adults because adults can consent for themselves. I don't advocate for children because I know that is very uh, it's very dangerous with CPS.
Yes.
Getting involved in hospitals have weaponized the CPS system against patients that don't just go along to get along with whatever they recommend for their, the doctors recommend for
Oh,
their
yeah, absolutely.
minor children. So I don't want children taken away from parents. And so I don't get
No,
involved and don't recommend this system for minors. Perhaps a good lawyer will actually join along with us and figure it out for kids. But we've figured this out for adults.
that is sort of a call to action too. I mean, because so many of these things do involve children.
Yeah.
Children
It's heartbreaking.
do get COVID. They do get pneumonia. They're going to the hospital. What about situations on the fly? Say you are in a situation where the medical care is not correct, not the right quality. Um, can you cover that in the contract? And are there other things that can be done?
Yes, yes. Let me give you some quick tips, okay? You
Yes.
can fire your doctor. You're in the hospital, you don't like what's going on, he's not, communicating, there's a failure to communicate. Fire him.
Right.
Say simply, "You're fired." Let the charge nurse, the nurse who comes into your room know that, "I am firing Doctor XYZ. I need to be provided a new one." The hospital's obligated to give you a new one. Say that one doesn't work. You're the person who's the consumer. They work for you. They are required to give you a new doctor. You can also leave AMA if it's not working. I tell people you're not married to the hospital. You're not even dating the hospital. Um, so you can leave. There's no obligation to stay, just to be nice. You can leave. And that
Right.
saved actually somebody I was advocating for. They left one hospital who was wasting time, didn't result in a simple little test. They wanted to put him on a COVID ward, and they said, "No, I don't. This isn't COVID. I'm over COVID." And she walked into another hospital hours later, and time was of the essence. That next hospital did the right thing and said she had the largest walking pulmonary embolism they've ever seen in this huge Texas hospital. So the
Uh-huh.
first hospital could have killed her if you were
Right.
just playing nice and going along to get along. She could have died of the pulmonary embolism, but she got
Hmm.
saved in the second hospital. You can also request a transfer, but just know this as a patient that the hospital receiving you has to actually agree and receive you.
Right.
But that's something that's in your rights to request a transfer. You can also, things I tell people to do is immediately get in the record. Yes, get into the electronic medical record ASAP. Have your document in the record. And there's a system of how you do that with the courier and a redundant backup system, which is certified mail return receipt requested. So you have a signature. Also, give copies, hand copies to the nurse, the doctor, everybody that you can hand a copy to. You're going to hand a copy of the notarized copy of the document. You're going to keep the
Right.
original like you would a will at home. You're going to also ask questions, ask what the risks and benefits are before anything is done to you. On the document, it clearly states to the doctor that you will give me informed consent. You will let me know the risk and benefits of any treatment, drug, therapy, or you'll be reported to the state medical board. And I recommend that patients do that. Report bad doctors who did
Exactly.
harm. This is something
Exactly.
that patients aren't doing. They're upset and they want to sue, and unfortunately, because of PrEP, they can't. But
Right.
you can, unless you have proof with this document that it was willful, which is intentional tort. Like if you just, which is the same thing as if you just put a pillow over a patient's face or punched him in the face. That's intentional battery. You did not ask for that, and you have the proof with the receipt of signature. But I urge people, please listen. You need to be the squeaky wheel. Ask, what are the risks to that drug? What's the reason? Why is it indicated? What are the options? Do I have any alternatives, reasonable alternatives to that drug? Before you just willfully just go along. It's not consent to say you have this problem, so we need to do this. That's not consent.
Right.
That's not the information part of informed consent.
We had heard reports of patients being, disallowed from removing the hospital by like calling security, calling the police. In those situations, it sounds like the hospital was not within their rights. Is that correct?
Hospitals are private institutions. They can make the rules. You can say no shoes, no shirt, no service. It's a
Right.
business. I think people forget it's a business, and they unfortunately do set the ground rules for visitation, that kind of thing. So you want to make sure you are bulletproof, that you walk in armed to the teeth, which is you have the documentation saying these. First of all, your rights. They're going to know
Right.
you're somebody not to mess with. Your rights.
Hmm.
They're already noticed legally. Uh, they've been noticed. That's a legal term with this
Right.
document, and it's been delivered in a way that absolutely needs to make its way into the electronic medical record per the AMA Code of Ethics, Opinion 2.1.1. When it's a written consent, it must. This is what they said. It must be
Right.
put into the electronic medical record. So once it's in the electronic medical record and the doctor sees that, they know this is a patient who knows their rights. This is somebody maybe you don't need to mess with. In Texas, Senator Bob Hall made it a right, and you can't violate this. It's a House bill that was
Hmm.
passed that if you have somebody that's a spiritual support,
Right.
they can be bedside and they cannot deny that person. So what does that mean? Does it have to be clergy? No. Does it have to, a pastor or priest? No. It could be your sister, your brother, your mom, your dad, your friend, your neighbor. If you said that's your spiritual support, they cannot be denied in Texas. People need to know that. Assert it. Don't just know it up here. Say
Right.
it. People need to actually verbally let them know, I know my rights. Be cordial. You don't want to set off any red flags and make it a contentious relationship, but definitely stand in your rights and let them know that I know my rights.
Absolutely. And, there are so many good tips too on your website regarding, other aspects of the hospitalization, the hospital visit. But this document that you
Mm,
refer to,
mhm,
that makes sure that the hospital is put on notice. I mean, it's
mhm.
such a powerful tool. And
Thank you.
so the website again is,
Ourpatientrights.com. OUR, patient singular, rights plural,
mhm,
.com. And it has the document in English and Spanish. Thank you, Dr. Joseph Mercola. I was on his
right.
podcast a couple of years ago, and he translated it into Spanish for us and said it would have circumvented the pandemic. That's what he said. He said this would have circumvented the pandemic because
That
you
is so
needed
good.
doctors to comply. You needed
Right.
doctors to prescribe. They're the only ones with a medical license, and they have a medical license to lose if
Mhm.
they don't adhere to your right to refuse.
Absolutely. Well, thank you so much, Laura. This has been so informative. Thank you for your work.
Thank you.
There's a phone hotline too, is that right?
There's a hotline if anybody needs help, even just understanding the document. I
Mhm.
have people calling me for all kinds of reasons, but the hotline is 888-219-3637. And there's no charge for that. I don't advocate for a fee. I just will be available to help.
My goodness. Well, that's so absolutely amazing and such a service and so necessary. I'm so glad that you were on the show. So glad that you educated us. I can't thank you enough for your time and for the wonderful work you do.
Well, I appreciate you helping amplify the message.
Absolutely. Thank you for joining us. And thank you, everybody, for joining us for this important episode of Doctors and Scientists.
Tell everyone your name
I'm Catherine Andrews.
and tell everyone about who this story is about.
So this is about a friend of mine, Debbie Boucher Larson, who passed away from the COVID shot and the booster. And I found about it found out about it through a Facebook posting from one of her family members, and I was just shocked to read her story, and I wanted to share it. I reached out to her family, and they really wanted me to share it as well. So what happened was Debbie is from Long Grove, Illinois, and she was told she had lupus, and she was told by her nurse to never get a flu shot because of lupus and the fact that she had a very low working immune system, if any. So Debbie was caring for her husband at the time who had cancer, and so the nurses suggested that she get the COVID shot to protect her husband. The same nurse who urged her not to get the flu shot, and said that the CDC recommended it and that it would be fine for her to take. Her daughter-in-law told her not to get it. She was a fan of the high wire and told Debbie not to get it, but Debbie didn't listen. She went ahead and got the first vaccine, and she was fine. Then she got the COVID booster, and that's when the problems started. What happened was Debbie woke up paralyzed after the booster. The doctors had no clue for her other than that she tested positive for COVID and that it wasn't her spinal cord. So basically then what happened was for 7 long months, Debbie suffered going from hospital to hospital. They conducted every brutal test you could imagine, tons of therapies. Debbie moved around from facility to facility and hospital to hospital and was only getting worse. Debbie was still getting plasma infusions because of her lupus. And she was told by certain people in her family, namely her daughter-in-law, not to get the plasma infusions because she thought that they could have blood was not being tested to see if it had, people who had the vaccine. But she continued to get the infusions. And so each time she had the plasma infusion, her health took a turn for the worse. Unlike in the past when the plasma seemed to help her, now it seemed to be hurting her. And her daughter-in-law wanted this to be known because it's important for people undergoing these types of blood transfusion treatments, plasma treatments. So Debbie entered into the hospital system helpless and paralyzed. She was paralyzed from the collarbone down. She was at the mercy of the staff. One facility in their negligence caused Debbie a bed wound so large from not turning her paralyzed body that no human could possibly overcome. Now seriously infected and paralyzed, Debbie passed away on March 3rd, 2023 after this long, exhausting battle of about 7 months. And so her daughter-in-law says, it's my hope that sharing Debbie's story can inspire those with autoimmune diseases to think twice before compromising immunity with an untested experimental product that can attack the spinal cord. Debbie was a long-time friend of mine and a student of mine as well. And I remember her as vibrant and healthy, and that's how I hopefully will.
Do we have a picture of her?
I do not. It's on Facebook, so I don't have it.
Okay, well, if you get one, do send it to us because we'll put her on the bus.
I will do that.
Thank you for doing this for your friend. You must sign the bus on her behalf.
I will. Thank you.
All right, thank you.
Autism destroys families. More importantly, it destroys our greatest resource, which are our children.
Robert F. Kennedy Jr.
pledged to find out what is driving the country's rise in autism.
Compiling medical records from a number of databases. He'll direct resources to study environmental factors, exposures, and external factors.
Scientific progress on this has been slow because scientists are frankly scared to ask the question.
Genes don't cause epidemics. You need an environmental toxin, and we're going to look at all the potential culprits.
With no a priori thumb on the scale, you can't look at that.
No.
I'm very grateful to the Secretary for finally saying from an important public platform that this is an epidemic and we need to find the causes and we need to stop it.
Other issues DHE has been pushing for years are finally gaining mainstream traction.
Today we're announcing we are removing industry members, pharma members from FDA advisory committees.
We're seeing reports that you're considering removing the COVID vaccine as a mandatory shot for children.
The recommendation for children was always dubious. The vaccine itself does have profound risk of myocarditis, pericarditis, even strokes.
Very, 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 very few people are still taking these things. In that sense, the mRNA vaccines for COVID in the marketplace are effectively dead.
We are working together to change the federal fluoride recommendations, and we're looking at the science now. There's a direct inverse correlation between fluoride exposure and low IQ in children.
Health officials announced plans to phase out 8 artificial dyes from our food supply.
The FDA is effectively removing all petroleum-based food dyes from the U.S. food supply.
We don't have a surveillance system that actually works, and that is a crime. And we will do that right away. And I understand the perverse incentives that need to be changed right away.
When there's a political will to answer a question like this, it will happen.
We're going to change things for real this time.